Namaskar, I'm Dr. Anshu Jindal, speaking from Jindal Hospital. I'm an IVF specialist and a reproductive endocrinologist. We're going to talk about a very important topic today. It's perimenopause and how to manage it. Perimenopause, we all know, is the period around menopause. It usually starts 4 to 5 years before the menopause. And it is a period of transition from a woman's reproductive life to menopause. So is it important to know and to recognize this period? Yes, it is very important to know and recognize this period because a lot of changes have started to happen during this period because of declining estrogens. A woman starts to gain weight. She has all the symptoms of menopause like hot flushes, night sweats, mood changes. Her sex life also changes. Hence, her bone loss is also happening. Her cholesterol level also start to rise. The so-called bad cholesterol, the LDL cholesterol. And this is because of decrease in estrogens again. And the protection that she had from heart disease now starts to decrease. In addition to that, she has irregular periods, which is very distressing for these women. And there are issues of contraception at this time. So we have Dr. Maninder Ahuja, Professor Maninder Ahuja, to throw light on this very sensitive issue of a woman's life. Professor Maninder Ahuja has dedicated her life to women. She is a director at Ahuja Healthcare and Dental and Infertility Center. She is the founder president of the Society of Meaningful Life Management. She has been the vice president of FOXI in the year 2013 to 2014. She has been the president of the Indian Menopausal Society in 2014. She has been the president of the Faridabad Obstetric and Gynae Society from 2008 to 2012. She has been the chairperson of Haryana chapter of ISAR and she has received the Best FOXI Award in 2008 for her best presentation. She has authored many publications. So let's hear from Dr. Maninder Ahuja.
Namaskar. I am Dr. Maninder Ahuja from Faridabad and consultant gynecologist of more than 40 years of practice. Today we are going to talk about 5 changes which you have to bring in your lifestyle in the perimenopausal period. Now what is perimenopausal period? Is the 5 to 7 years earlier than your menopause, and the average age of menopause when you stop having your menstruation is 46 years plus minus 6 years in our country. So first change which you have to bring about is change in your attitude. Stop being negative. That is very, very important because if you have to bring some lifestyle changes in your life, you have to change your attitude. You have to stop saying that I am 50, 60, 70 years and I can't do this thing, I can't laugh loudly, I can't wear red color, I can't wear these dresses and all that. So change in life, enjoy your life and add life to your years and not only years to your life. The first thing is that. Second is you have to control your weight because in this phase of life you start having weight gain, and weight gain can be controlled by proper exercise and vitamin D, calcium and diet changes that is very, very much required in this lifestyle. So calcium and vitamin D requirement are calcium is 1200 milligram. Consult your doctor, whatever you can take from your diet, otherwise take the supplements. Vitamin D about 800 international units per day. Your hemoglobin should be 12 gram. Your weight should be roughly your height in centimeters divided by subtract from that 100. So that should be height, or BMI you can calculate your weight in kgs divided by your height in square meters, and it should be between 18.5 to 24.5. Maybe around 25, 26, that should be the ideal weight which you should be having. And to control that weight, the only thing which you should avoid taking in this age group is refined carbohydrates. So stop taking the flour, pizza or burgers, anything. Restrict them a lot. Take lots of green vegetables and fruits and add proteins to your diet. See to it that your hemoglobin is corrected. Then another and exercise regularly. That's very important. For exercising, not only you have to do your walk, but you have to start doing some resistance and some weight training also, so that your bones are built and you stand erect. So you have to do balancing exercises also, like Tadasana or Vrikshasana, so that you don't fall and have the fractures. After that comes the screening for the cancers. Very, very important, because in this age group you have increased incidence of all the cancers, whether it's cervical cancer, is the uterine cancer, or it's your ovarian cancer, or the colon cancer is there. So you should get to reach your doctor, take their appointments for the screening of these cancers, and every 2 years you must visit your doctor. Then diabetes, hypertension and heart disease, they have to be controlled by proper exercise, diet, and very important is then the meditation. So 1 day in a week you should have for meditation, and 5 days, 3 days aerobic exercise, and 2 days weight training and resistance. So keep yourself healthy, add life to your years, and not only life to your years. Remain healthy.
Thank you, Professor Ahuja, for giving such insights into the management of perimenopause. You have indeed made it very simple for all our viewers and given us such pearls of wisdom. To sum up, I would just like to say that perimenopause is a very important time, and irregular periods can have to be handled during this time as well. If the periods are heavy or painful, the patient needs to be given oral contraceptive pills, or even progestagens like medroxyprogesterone acetate may have to be given for 3 to 6 months. As far as the hot flushes are concerned, actually exercise as well as certain lifestyle changes such as avoiding alcohol, smoking, spicy food, wearing loose clothes, and avoiding hot environment might help. And even deep breathing exercises would also help in getting over these hot flushes and night sweats. Maintaining your weight is very important. And certain drugs like antidepressants like paroxetine and fluoxetine, venlafaxine may be prescribed to you at some point during your perimenopause. In addition to that, certain B-complex vitamins, sometimes gabapentin, evening primrose oil, B-complex can also be prescribed to perimenopausal women. For prevention of osteopenia and osteoporosis, one should take good amount of calcium and vitamin D, as has been stressed by Dr. Ahuja as well. So, thank you so much for watching. If you like this video, please click on the like button and subscribe to our channel Global ART Forum, so that we can bring such videos for you in the future as well. Thank you.